I'm Jaden Meservy. I'm a junior at Salem High in Idaho, and I love reading, sports, and spending time with my family, and I was born with Hypoplastic Left Heart Syndrome. Most people think with heart defects that you can't do much of anything, but you can. I go camping, I ran a 5K, I lived in a different country, I play sports, I'm just a normal kid.
My mom found out she was pregnant with Jaden not long after we lost my sister to heart complications and Down syndrome. When my parents were getting the ultrasound done to find out if Jaden was a boy or a girl, the doctor noticed something unusual.
The doctor that I had looked at the ultrasound and kind of looked away, and then he said, I don't think this is anything, but with your history, and I know how you worry, he said, I see something he said, it's kind of like shiny where his heart is, and I think you'd just feel better if maybe you got it checked out.
My parents met with a heart specialist at the University of Utah, where my mom had another ultrasound. But once the doctor began the ultrasound, he immediately stopped. The doctor explained that this baby would have a very serious heart defect known as Hypoplastic Left Heart Syndrome.
Hypoplastic left heart syndrome is a complex congenital heart disease, and it's different from a normal heart in many ways. So in the normal heart, you have upper chambers and lower chambers, and then you have a right side and a left side. So the right upper chamber receives blue blood or deoxygenated blood from the brain and the body, and it goes across the valve to the lower pump on the right. Those are called ventricles, and then it pumps it out through the pulmonary artery to the lungs. And when it hits the lungs, it gets oxygenated, comes back on the left upper chamber, now as pink or oxygenated blood, down to the lower pump on the left through a valve there, and then it gets pumped out the aorta, which then supplies blood to the brain and to the body. So in hypoplastic left heart syndrome, the right side is fine, no issues with the right side of the heart, but when blood comes back from the lungs to the left upper chamber, in Jaden's case, and in many people's case, there is no valve there to allow blood to go from the left upper chamber to the left lower chamber. Pink blood goes from the left upper chamber over to the right upper chamber, and then back down to the lower pump on the right again. In that situation, the left lower chamber, the left ventricle, doesn't grow because there's no blood flowing into it. And because there's no blood flowing into it, no blood flows out of it either. And so the valve allowing blood to get pumped up to the brain doesn't form either. In terms of how many patients or people are born with it, we would see in Utah about one patient per month. We had roughly 150 newborns with congenital heart disease that were operated on every year. So it's under 10% of all the congenital conditions, that we see.
And at that time, which was almost 17 years ago, he said that we had a few options. One, I was about 5 months along now. He said medically speaking we could abort, and it would be something doctors would say would be ethical to do. We could have the baby and not do anything, and the baby would most likely die within a couple weeks. Or we could deliver the baby and do a 3-part corrective surgery, which there were a lot of variables as to whether or not it would be successful or not.
For my parents, there was never a choice to make, no matter what they planned to deliver their baby. Jaden was born March 3rd, 2004 at the University of Utah, but it wasn't a delivery like most parents experience.
So as soon as I delivered, they need to put him on medication so that he could stay alive before they start the next surgery. So they delivered him and immediately passed him through the window to the intensive care unit.
The survival depends upon what is done and at what surgery level, and if you decide to go surgery or not.
My parents chose the surgery route, but because Jaden was so small when he was born, doctors had to wait 5 days before they could do his first open heart surgery called the Norwood operation with a Sano shunt.
So you take the pulmonary artery and the aorta, you combine those two together, and then you patch all the way around the aorta because you need all the blood flow in the right lower chamber, the right ventricle, to pump that blood to the brain and the body.
But when you combine those two vessels, you have no way to get blood flow to the lungs, so you have to create another way to do so. For Jaden, that meant having a Sano shunt, which is when doctors placed a 5mm tube inside of him. Jaden was the second baby at Primary Children's Medical Center to have the Sano performed.
Blood has a choice once the ventricle contracts to either go up to the brain and the body or out to the lungs. You got to just kind of get that just right. And if you do, then the kids have saturations that are in the mid 80s instead of 100%, like a child with a normal heart.
I remember after the first surgery that I asked the doctor if I could go in and see Jay. They had left his chest open, so for two reasons: so that the heart had somewhere to swell if it started to swell, and number two, so that if there was a problem with the heart, they could have immediate access to it. And I will never forget going in there to see Jaden, and he was laying there with his chest open still, and that little heart was about the size of a walnut, and it was just beating away.
You're able to handle that circulation as you grow for about 4 to 6 months. And the reason why it's a shortened time period like that is because you will get progressively more desaturated or bluer as you grow. Once you get into that range, so Jaden I think was around 5 months old, then you go to the second stage surgery, which is called a Glenn. And the Glenn operation disconnects the vessel taking blood from the head back to the heart, and it connects it directly into the pulmonary artery. So your saturations are back up into the mid 80s again, but you still have blue blood that's mixing with the oxygenated blood in the heart, which is why you need another surgery.
Jaden had his third surgery called the Fontan at about 2.5 years old.
The Fontan operation disconnects the vessel taking the blue blood from the body to the heart. So when that happens, then you have all the blue blood from the brain and the body that is passively flowing into the lungs now. So it's not being pumped, it's just passively flowing to the lungs. And then the oxygenated blood that comes back to the heart is no longer mixing with blue blood. And so then you're more fully saturated. Your saturations typically are up in the 90s after the Fontan operation.
So after Jaden had the Fontan, we asked how we get on the heart transplant list because they said at some future point he would need to be on that. The surgeon came out and said, I think that he has a better chance of getting run over and hit by a car than needing a heart transplant.
Jaden continued to progress forward, but a few years later when Jaden was in 4th grade, his teacher noticed he kept falling asleep during class, and that wasn't typical for him. Jaden met with his doctor, and it was decided that he needed a minor procedure that would redirect the oxygen so both extremities were getting more oxygen.
And immediately, it's like he woke up. It just made a world of difference for him.
There's a broad spectrum of how these kids do. So the first surgery, as I said, is kind of the most complex and carries with it the most mortality. But then there's children between the first and the second surgery who also pass away. So about 10 to 15% of the kids will pass away in the first 6 months of life. And then after the Glenn, like I said, low mortality risk, same thing with the Fontan. But by 5 years of age, more children have passed away, such that the average at about 5 years for children with Jaden's condition is about a 60% survival. So how is Jaden, different? Well, he's one of the survivors, for one. And then of those kids, that's 60%, there is a group of kids that have lots of complications. Then you have a smaller group like Jaden that are just doing really well. So their bodies seem to handle this change in plumbing, which is really what those surgeries do. It's basically changing the plumbing. I would say Jaden has just been of that smaller good group who's been able to thrive and do the things that he wants to do by and large, why that happened, I don't really know, but it's awesome when it does. That's what we hope for when we start out on this plan, when the babies are born, that this is what you get. And sometimes, it happens. And I think you just celebrate it when it does.
Today, Jaden is only taking an aspirin once a day, a beta blocker twice a day, and once a year he meets with his cardiologist. Despite all the odds he's beaten and how well he continues to do, he still has his own challenges and worries.
Some of the struggles I have to deal with are my toes and my fingers are always ice cold, and I worry a lot, like if my heart's going to quit on itself, or if I need a heart transplant, or if I get sick, or just flat out die.
Having a child with a heart condition or something that can affect them for the rest of their lives changes a lot with your family. And what I've learned from this is you can't tell the condition of someone's heart by looking at them. Jaden looks perfectly healthy, and some people are shocked when they see how healthy he is, and that he's tall and always has pink in his face. And sometimes you just can't tell what people struggle with, and I think that's one of the biggest things I've learned, is not to judge what you can't see, and especially with someone's heart.
So one thing this has helped me realize is how fragile life is. But I've also learned that there's a balance between living in the fragile part of life and wondering what's going to happen to your son and your boy or your child, and also trying to treat them like any other normal kid so that he can have a normal life. And that's an interesting balance to walk.
Advice that I would give to kids with my condition would be just not to worry. I mean, don't let your heart problem define who you are. You can do whatever you want, and just to always have hope and just never to worry about anything.